I would ask that the clerk please call the roll.
Senator McGarvey.
I am present remotely from the district.
Thank you. Senator Nemes.
Present in the room.
Senator Schroeder.
Present remotely from the district.
Thank you. Senator Storm.
Present remotely from my district.
Thank you. Senator Thomas. Senator Wise.
Present remotely from my district.
Representative Blanton. Representative Fleming.
Present in the room.
Representative Hatton.
Present from District 94.
Thank you. Representative Jenkins. Representative Riley.
Present in the room.
Representative Sharp.
Present in the room.
Vice Chair Howell. Vice Chair Beckler.
Present remotely.
Co-Chair Carroll.
Present in the room.
And Co-Chair Nemes. Thank you.
Okay, I would remind everyone who is remote to please mute your computer so we do not have any feedback. And also remind you that if you have questions, please use the chat function on your computer to ask those questions or to ask to be recognized to ask those questions. And the first item we have on the agenda is approval of the minutes from the August 12th, 2021 meeting. I would entertain a motion. Senator Nemes, have a second. Representative Riley. Have a motion and a second. All those in favor, please signify by saying aye. Opposed, no. Motion carries. Minutes are approved. Today we are going to hear a staff update from a report back in October of 2019, the non-academic barriers facing Kentucky community and technical college students. And this was research report number 462. And we're going to open up with our two committee analysts, Steve Hall and Shane Stevens. And following that, we'll have a response from Dr. Zapata. And I hope I didn't butcher that, sir. Glad to have you here with us today. And then Dr. Chris Williams, the Chancellor of the Kentucky Community Technical College System. Gentlemen, please introduce yourselves for the record, and you have the floor.
Thank you, Mr. Chairman. Good afternoon. I'm Chris Hall. To my right is Shane Stevens. We're analysts for the committee. And as you know, representatives from KCTCS are here today to talk to you about an update on their progress towards implementing the recommendations that staff made in our 2019 report entitled Non-Academic Barriers Facing KCTCS Students. A copy of that report, today's presentation from us, and KCTCS's report are included in your folders today. Before KCTCS officials speak, we thought it might be a good idea to provide members a quick recap of what we found in that study and of the recommendations that we made. KCTCS is the largest provider of higher education in the state and consists of 16 individually accredited colleges and a system office in Versailles. With more than 70 campuses, branch campuses statewide, it serves all residents of all 120 Kentucky counties. The first thing staff did in our 2019 report was to look to see how KCTCS students differed from their state university counterparts. This graph shows, in summary, that KCTCS students are more likely to be the first in their family to attend college, to be academically unprepared, to have dependents, to come from a lower income household, and they tend to be older. Research shows that characteristics such as these can create non-academic barriers that can have a negative impact on a student's ability to achieve their academic or career goals. Now, while the concept of an academic barrier makes sense to most people, the term non-academic barrier is a little more vague. We can consider non-academic barriers to occur when a student, for instance, from a low household income, has to decide between paying his or her tuition and putting food on the table. When a student who is a parent has to make the decision between sending their kids or participating with their kids' sports or spending quality time with their child and preparing for an exam. It can also be something as simple as a student who is going to college but doesn't have a clear plan for academic goal or job goals or career goals. Now, to better understand the types of non-academic barriers that KCTS students face, staff asked the president of each college to provide us a list of their top 5 non-academic barriers present on their campuses. Staff used this information in consultation with KCTS System Office and a detailed literature review to develop this list of 5 common non-academic barriers at KCTCS. The first, inability to navigate college, relates to problems that arise from students having difficulty figuring out things such as, what's the deadline for registering for classes? How do I register for classes? Am I eligible for financial aid? How do I fill out a financial aid form? Where do I go to get it? Or the fact that they need to meet with an academic advisor to set up a plan for their education at the school. The second barrier, financial instability, may include things such as household insecurity, food insecurity, a lack of transportation to get to classes, or an inability to find affordable childcare. The third barrier, competing time constraints, occurs when a student must balance their time needed for school with other responsibilities, such as family, work, or caring for an ailing parent. Personal health issues, the fourth barrier, includes pre-existing medical conditions, major medical events, and mental health problems, the latter of which was specifically mentioned by several college presidents as a non-academic barrier their students face. The final one, disengagement, is a student's lack of personal connection to the college. This can result from the person feeling they don't have anybody at the college they can go to, such as an advisor, a lack of feeling like they want to engage with campus events, not having a sense of community, or feeling uncomfortable engaging in the classroom. While we know that community college students are more likely to experience these non-academic barriers than their university counterparts, KCTCS does not have reliable data on how prevalent these barriers are among their students at each campus. The system office reported that outside of anecdotal information, they really had no way to collect additional data. So the committee staff began looking around to see if we could use regional socioeconomic data to develop proxy measures for these 5 non-academic barriers. For example, we used annual household income as a proxy measure for financial instability and found that the statewide average was $64,000 annually, while more than half of the KCTS students who filed for federal financial aid reported an annual household income less than $40,000. Looking at housing insecurity, which can be defined as a household who spends more than 30% of their annual income on housing, we found that statewide the figure is about 50% of households earning less than $50,000 were housing insecure. Using a similar measurement, we found that individuals who are food insecure varied statewide between 12% and 20%. We also looked at the burden that comes from not having access to child care and found that statewide, there are licensed child care slots available for only about half of the children ages 5 and younger. Since community college presidents did mention mental health issues as a persistent problem in their schools, staff looked at access to mental health care providers as a proxy measure. We found more than half of Kentucky's counties reported a ratio of 1,000 or more residents per mental health care provider. Staff was unable to develop proxy measures for the remaining 3 barriers. Now, while these measures we developed provide a good picture of what's happening in various regions of the state, they're not accurate, nor are they a substitute for data specifically related to students who attend KCTCS schools. Therefore, our first recommendation was that KCTCS system offices and colleges should develop methods to determine the prevalence of specific non-academic barriers at each college and track the prevalence of such barriers over time.
In addition to looking at the data and developing proxy measures, staff also asked colleges to provide information on the programs that they were using to help students overcome non-academic barriers. The presidents of each college responded, and a total of 142 programs were reported. The number of programs per college varied, ranging from as few as 3 to as many as 17. Staff placed these programs into categories based upon which barrier they targeted and what type of service that they provided. The most common barriers targeted were financial instability and navigating college. And advising was the most common type of service provided. The colleges were also asked to report how they measured success of programs. About half of the programs tracked usage, about 40% tracked retention, and about 30% tracked attainment. The responses that we received from the colleges, as well as staff's own experience in analyzing the data, demonstrated the difficulty of identifying and categorizing non-academic barrier programs given the current level of data being collected at the time. For example, many programs were not designed to address specific non-academic barriers, instead focusing on improving student success more generally. Likewise, many programs primarily addressed academic barriers and only indirectly affected non-academic barriers. There was also significant variation among colleges in regards to how programs were operated. Of particular note were differences in how colleges measured program success. Colleges primarily used 3 methods: usage, retention, and attainment. Usage indicates the amount of service a program provides, but does not indicate if the service resulted in changes in student success. Retention tracks whether a student returns to college and can serve as a stronger metric for linking a program to student success, but also requires more data. And finally, attainment, which measures whether a student obtained a degree or a job, can demonstrate an even stronger link between a program and its effect on students, but in turn requires even more data. Ultimately, the difficulty of determining program impact and linking programs to student success led to the following 2 recommendations. Recommendation 2 was that the KCTCS Systems Office should develop more accurate measures of non-academic program success that focus on determining whether a program decreases the prevalence of the problem it was designed to address. And recommendation number 3 was that the KCTCS Systems Office should study the relationship between programs, student success, and retention, and that the results should be shared with the colleges so that they can improve existing programs and more effectively implement future programs. On May 7th, KCTCS released a report in response to this study, which they will be discussing with the committee shortly. Before they do, staff would like to commend the high quality of the study and note that it addresses all of the recommendations made in the 2019 staff report. We would also like to note that it also addresses all of the non-academic barriers that the report identified. Staff were also pleased to see that the study emphasized a focus on data collection and data analysis, which was a key concern for the 2019 report. One potential challenge facing future program evaluation is that while the program KCTCS selected for analysis was an ideal choice because it is both used by all of the member colleges and is a program that relies heavily on data collection, the success of other programs may likely prove to be more difficult to measure because few are as ubiquitous or data-driven as the program used in the pilot study. Future analysis will likely require additional steps, including the standardizing of programs across colleges and the implementation of data collection for programs where it does not currently exist. And this concludes our portion of the presentation.
Okay, gentlemen, thank you. Are there any questions to staff before we move on? Seeing none, we will go ahead and I'll ask Dr. Zarapata and Dr. Williams to please come to the table. And we have some handouts that was provided by KCTCS. Mr. President, it's good to meet you, sir, and welcome to our committee. And I would ask that you both please introduce yourselves for the record, and you have the floor.
Sure, and you hit my name perfect. Dr. Paul Zarapata.
I asked before I tried it on the microphones. I've learned lessons with that.
And to my right is Chancellor Dr. Chris Williams.
Good afternoon.
We are very pleased to be here today. The presentation ahead of us stole a little bit of our thunder, but we'll still move on here. If it's okay with you, Senator Carroll, I'm going to move forward with the presentation, if I don't screw this up. Here we go. So as was mentioned previously, we've got 16 independently accredited colleges across the state, over 70 locations. The mission of community colleges is to provide access. And so we're all over the state so that students can stay close to home and don't have to go to the universities and stay in a dorm if they don't, or if they can't. Over 100,000 students served annually, and we're an open access institution, meaning anyone can come to us, except in a few different cases. I guess Allied Health and some of the others have some wait lists. So this was mentioned previously too, and I think if you stripe this across the pandemic, you can see why our enrollment has been hit so hard. A third of our students have got dependents. Daycares have been just hit hard. Every day it seems like I'm hearing from faculty and staff that their local daycares have all tested positive. They're shutting them down. When that happens, obviously, if you've got a choice between staying at home with your children or going to school, you know what they're going to do. They're going to stay with their children. And so, the first generation, and almost 46% of our students are over the age of 25. And so this is a huge difference from the universities. And I just, I'm so grateful to get the opportunity to kind of share the differences of our student profile versus the universities, because it's very different and they have very different needs. So there was 5 prominent non-academic barriers to student success. When you look at that last one with disengagement, this is another one that's really difficult in community college where there are no residence halls or food services or sports. Students just don't get that opportunity to build the same kind of connection as they do with the university. And so At times, the only time to build a connection is between the parking lot and their classroom, or it's even harder if they're online students. And so our faculty have got to really, really do just a tough job to try and get these students to interact and feel engaged and feel like they're part of the local community and in that college. So this was mentioned as well. And so we've got over 140 programs that target these prominent non-academic barriers. All colleges have at least 3 of these. 11 have at least 8. And just as a footnote there, the percentage is summed to greater than 100 because the program, well, and it's blacked out there.
Programs target multiple barriers.
Multiple barriers. Thank you. So the LRC report included 3 recommendations. You're going to hear a lot about a software package called Starfish. What Starfish is an analytics package that basically gets real-time information from students, and faculty and the students can interact, and it's used in multiple ways. And I'll talk about that in just a moment here. So recommendation 1 was that the colleges should develop methods to determine the prevalence of specific non-academic barriers at each college. And our response was to leverage technology. The first go at it is we were going to try and collect this information up front on the admissions application. And after speaking with some students and speaking with people on the front lines, it really almost turns into a barrier because you're listing all these things that the students might face, and if you're collecting it there, it's almost a disincentive for them to apply and come to the college. And so, as happens, we have to blow stuff up and move on. And so what we've come up with is a new way to collect this data from the student information system during the registration process, so it's not so invasive. Many of the students that use some of these services are, for lack of a better term, embarrassed to identify themselves for using it. And so food insecurities, or if they need, emergency loans for a flat tire, things like that, the things that get in the way of them just being able to go on with their lives. And so we need to come up with a non-invasive way to do it, but we also need to have that information so that we can be proactive in reaching out to these students. We're doing a good job with it, but again, we are still implementing this technology solution. The second one was to develop more accurate measures of non-academic program success that focus on determining whether a program decreases the prevalence of the problem it was designed to address. So, and again, we have 140 programs out there, and we didn't know exactly which ones were successful and which ones weren't. And so we decided that since Starfish was used across all of these programs, we were going to go ahead and use this to basically try and implement these solutions to collect this data and to interact with the students. So the assessment instruments were developed, validated, and piloted, and the processes established serving as a blueprint for evaluating other programs targeting non-academic barriers. The third recommendation is we should study the relationship between the programs that decrease non-academic barriers, student success and retention, and the results should be shared out with the colleges so they can improve existing programs and implement future programs. So Starfish, you can give kudos to student achievement. So if a student does good on a test or a quiz, you can send them a hey and you can customize it to them. As minor as that might sound, it really resonates with students that might not necessarily get that with our first generation students, they may not have family that value college or understand how important it is to get some support. If you get 100 on that really hard Spanish test. There's flags that you can set for areas of concern. If a student misses multiple assignments, if they really blow a test, things like that, so you can reach out for help and make sure that they're getting what they need to do. You can make referrals to different support services all across the colleges and also give them to-do items so that they've got a list of things that they know what they need to do. Because again, especially for these first-generation students, and especially for this incoming class of freshmen that, during COVID were online mostly, as for half their junior year and all their senior year, it's tough to navigate these things. It really is. And being able to give them some pretty straightforward checklists of what they need to do really helps. And then there's appointments, and that's advising appointments, counseling appointments, even mental health service appointments, and those sorts of things. Now, the key findings, they showed significant relationships with all measures of student success. GPA, we could use starfish interactions to predict which students are struggling academically and provide assistance and support before it's too late, which is when the grades get posted. Credits earned, kudos, increased credits earned. Flags and to-do items are associated with fewer credits earned. Retention, the kudos increased retention, and the flag signaled lower likelihood of retention. Credential completion, again, going back to the kudos, that helped with credential completion. And the findings were more pronounced for targeted populations, such as low income, URM, and part-time. The kudos have a greater positive effect, and the flags indicate stronger signs that additional support is needed.
And Dr. Zarapata, if I may, URM is our underrepresented minority students.
Yes.
Don't want to have acronyms that folks may not know.
Yes. And so here's some of the things that we're doing, knocking down student barriers. Food pantries, partnerships with Goodwill, the United Way, YMCAs across the state, mental health counseling, transportation assistance. For example, at Jefferson, they have a bus pass program so that students can ride the Louisville buses. Arrangements with child care providers. Unfortunately, we don't have nearly as many of those as we need. And then assistance with financial aid and financial literacy. Also, we've got microloans or microgrants as things may come up. Again, with, sometimes the difference between a student dropping out and a student continuing on with us and being successful is a flat tire because they just can't get in. And so it's very difficult. So some of the things that we're doing around innovation, flexibility, and support, obviously we need to offer these programs. When you have a student base that is almost half 25 and over, you've got to meet them where their lives are. And so we've come up with some very innovative programs across the state. And I'll just give a few examples here. At Ashland, they teach welding 24 hours a day. There's 3 different shifts that come in. Skyflex at South Central. This is a program that utilizes advanced manufacturing, electrical technology, engineering and electronics technology, industrial maintenance, welding, air conditioning technology, automotive technology, and collision repair. And it's ideal for adult students because most of the work is completed online via interactive learning tools, but then the students go to campus 1 day a week for a hands-on lab with the instructor so that they can still work and they can still learn. And then there's Tech Express at Owensboro, which is similar. You can take classes during the evening or early morning hours. And also for COVID-19 support, back when the pandemic hit, I was actually the chief information officer. And so what we had to do was mobilize. What we realized very quickly was that our students, in many cases, did not have adequate Wi-Fi at home. And I'm sure you've all heard this ad nauseum about the Wi-Fi needs across the state, or broadband in general. And so we gave out laptops, we gave out Wi-Fi hotspots, we set up mobile Wi-Fi units in most of our parking lots, and also advertised this to all the universities because their students were at home. And so we had some parking lots that would have 50 to 60 cars in it, all using our Wi-Fi so that they could still do their coursework. And I sincerely believe we're the solution to Kentucky's workforce shortage. We award 98% of all short-term certificates in Kentucky. We train 82% of Kentucky's skilled trades workers. We award 2/3 of Kentucky's nursing and allied health credentials. And then nearly 80% of credentials are awarded are in Kentucky's top 5 industry sectors. And I'll be around to talk to everyone. We're working closely with CPE, but things that get really expensive for us are these wraparound student services and success coaches. Right now, our success coaches get assigned to about 600 students. And so that 1 to 600 ratio gets pretty difficult. We've got a lot of old buildings. It seems like every week we've got an HVAC unit that goes out, and that's $2 million a shot, it seems like, all across the state. Nursing program support, and of course CDL training expansion. That's the end of my presentation. Again, I really appreciate the ability to kind of tell our story to you, and with that, I'll open it back up.
Thank you, Dr. Zarapata. I've got a couple questions just to open up, and there may be others. You talked about the enrollment, and obviously during COVID, those issues. What are those numbers looking like throughout the state, and is it fairly consistent throughout the state that numbers are down?
They are, and they tend to match the workforce participation rate, which is pretty low. We are. Is it relatively flat year over year from fall to fall?
We're actually a little bit down from last year even. We're not sure if that's the uncertainty about childcare and kids in school or unemployment concerns or other, but we're down, I want to say, around 2% right now from our last fall. That head count's a little odd because we have so many types of head count. Dual enrollment is pretty good right now. But our workforce classes, where we're partnering with our employers, are really down at the moment, and our credential-seeking students are down at most colleges. I believe Gateway and a couple of others are flat or a little bit up, but many of them are seeing severe drops.
And you mentioned childcare as one of the struggles. If I remember correctly, at WKCTC, Did they not open the Scholar House, and then that ended up moving over to different owners eventually? Is that a model throughout the state where the community colleges are building their own child care facilities to operate, or is that something you all are looking at?
So the Scholar Houses are available at a few of our campuses, including WKCTC, West Kentucky. We get a lot of CTCs in there. The way that a Scholar House works, if you all are not aware, is it's Section 8 housing that's available for single parents, male or female, who have small children and are enrolled in a higher education institution full-time. And so there is a daycare on the site. Some of those daycares also accept children from other sites or, just students in general. That model is difficult to replicate because the Kentucky Housing Authority does not always have available Section 8 vouchers that can be attached to a facility. But certainly it's a wonderful model, it's very successful, and we are trying to increase that. We also have some Head Start partnerships. So Henderson, for example, has 2 Head Start classrooms on their campus, and it is just for students at the college. The children can go full day or half day, and that includes both toddlers and infants. Some of the colleges do have or have had child care facilities. As you all know, there's a lot of liability and concern around operating your own child care facility. It's a little bit outside of our mission, and so in most cases we try to partner, as we do with the Kentucky Housing Authority or Head Start, to manage those child care partnerships. But we also have very strong early childhood programs, and so our students do intern in those facilities. It's a wonderful partnership back and forth.
And I can vouch for that. I know we've had students at our facility at Eastern Duca, and and I think and I don't know that we have ever been asked to reserve any slots. And when you brought that up, that kind of made me think maybe we need to reach out to the community college and maybe see if they want us to reserve so many slots each year. So maybe that's something in the communities throughout the state that the colleges could reach out to private providers outside of those you just mentioned to perhaps help in that area.
We appreciate that. We are working with, as Dr. Zarapata noted, United Ways. We also work with several housing authorities. So much the community college is in the community, right? So they are able to make those partnerships. And I appreciate that you're thinking about how your organization can strengthen that partnership as well.
Yeah. And we have an excellent school. I cannot say enough good about Dr. Reese and the programs on that campus. Quality, I think, unmatched anywhere in this state, and they just do a great job. Representative Fleming, you have a question, sir?
I do, Mr. Chairman. Thank you. I'm trying to get my head more wrapped around what the issues are in terms of the barriers that you described, and you did a nice job in terms of laying some partnerships that you're trying to formulate and cultivate, I should say. Is there any effort with businesses in terms of trying to partner with them, either from a funding point of view or for a child care perspective? Because you list a couple of them, but I haven't really heard anything from the business community.
So are you asking if we have, say, a set of childcare providers that we partner with at each college for referrals? I'm misunderstanding your question.
Well, and may not be doing a good job in explaining what my thought is, but there are businesses that have relationships with childcare as well, or have a childcare located within their facility. At least they used to before pandemic. That's what I was trying to figure out. Instead of maybe having those types of facilities or opportunities on the college campus, utilizing the private sector in terms of doing some partnership and so forth.
There were some of those before the pandemic, and because they had some access capacity before that, they could take in some of these children. But I think with the pandemic and I forget exactly how they've reduced the number of students or children per daycare worker, but I don't think it's as prevalent as it was. But that's a very good point. I'm actually starting I've gone to 2 college tours now. I've got 14 left, and one of the things is with business and industry, and I can certainly bring that up. That's a very good point. Especially if they've got access capacity where we could help, have our students come in and put their children in.
And it seems to be a common theme, at least in my mind, among a couple of things. But childcare, providing childcare runs through not only for individuals to go back to school, but also go back to work.
Right.
And it seems that, I guess the state could do a little more, have a little more effort in terms of trying to fuel the support of folks to go back to school or go back to work by having child care type of facilities. You're going to say something?
I'm sorry, I was going to add just a couple other thoughts. One is we partner a lot with employers, particularly around apprenticeships or work and learn experiences. So in that sense, the employer that provides child care is providing it for their employee while they're at school. So that does help some of our students. I would also say we are working with the Kentucky Chamber on a child care provider initiative or some recommendations that could come forward. Childcare does not pay well. It's a profession that does not pay much. It's harder to bring people in. If you're going to make $9 as a childcare provider or $15 to $18 working at a distribution center or a fast food place, you're less likely to be a childcare provider. And so I do think there are opportunities to think about how to help subsidize childcare. But the third thing I want to mention is a really cool program at one of our colleges that is around non-academic barriers. It's called Tuesday Night Live. It happens at Hazard Community and Technical College. They have not been able to do it since COVID started, but they're looking forward to restarting it. And every Tuesday night from 6 to 9, their students are on campus with their children. They prepare all of them a meal together and eat that. Then the parents go to class, and the early childhood students take care of the kids and work with them in their homework. So it's a wonderful kind of family orientation to learning, and that's been very successful at HCTC. And I think will probably be duplicated as we come out of this setting where people are uncomfortable being together and move more into a social environment that allows all these kids and parents to be together.
And that's a creative solution. That's good to hear, and I would encourage you to replicate that, throughout the state. One more question, if you don't mind, Mr. Chairman. That is the mental health as a barrier. Could you expand on that a little more in terms of that being a barrier and a challenge, and how that's being addressed?
So we have a partner. The Council on Post-Secondary Education has put out, I can't remember the name of it.
Mental Health First Aid and Mental Health 101, and then a software access TAO, therapy online access.
That's right. Yes. So we've got numerous ways, and obviously students that are on campus can speak with advisors who can direct them to mental health. This is support through online chat, phone calls. In some cases, there's referrals that can be made out to local mental health facilities if the student needs face-to-face or is having some very serious problems. COVID did a number on a lot of people, but on our students, the pressures that they already had in their lives, and this just compounded it. And it's not just our students, our faculty and staff too. I don't think we've ever had so many, calls out for help for the resources. We've had them in place. We just haven't advertised them very well, and so they are taking advantage of them. As CPE's funding for this runs out, we will definitely pick that up and continue it because it's very important.
Okay, well, thanks for the explanation. I know Eastern Kentucky is very much void when it comes to mental health issues and so forth, and I would encourage y'all, whatever you can do to partner with facilities that offer mental health services throughout the state, and look at the telehealth type of an avenue to make that come to fruition. Thank you, Mr. Chairman.
Thank you. And I would also let the committee know that as far as child care, with the federal funds that are coming in, anyone who wants to get not just a certificate but a degree, there's funding available to do that. So you can basically get a free education now with the federal dollars coming in, and that's one of the efforts to increase the number of child care workers. But she's exactly right. It's if you depend on a child care center to feed your family as an owner, you're taking a huge risk because it's just not a profitable business at all. And having doing this for, I guess, 11, 12 years now, and we just went through a process of increasing pay and benefits, but we have other programs that financially support our child care program. And without them, our center would have closed a long time ago. But and I think it is an ongoing issue that we're going to have to be heavily involved in as a legislature. And I think the entire structure of child care in our Commonwealth has got to change. And I don't know if that means that there's a greater tie to education. Perhaps early childhood education moved in to that cabinet, and funding annually to supplement local child care providers to be able to pay for quality, for instructors, for teachers. And that's a word that we use at our center. We're not child care providers, we're teachers, and we run a school. And I think that that we do need to be tied in with education, and we need to be looking at the very same, and dollars need to be allocated the very same to help these centers grow throughout the Commonwealth and to continue to improve the quality. We've made a lot of progress over the years through the Kentucky All-Stars program and other initiatives. But as I say that, I'm well aware of the deserts we have in the state where we have no providers. So we're fighting two battles, just to have child care on one hand and to provide quality child care on the other. So this is a huge issue for a lot of different reasons that we're going to be facing, I think, in the years to come. And I think it's the one issue that we're really going to have to think outside the box of where we are right now as a state, because our model doesn't work. And I think it's refreshing to hear legislators from both sides of the aisles have taken up this issue and have become very familiar with it and are willing to look at various ways to make the changes. So for what it's worth, that's just the things that I have seen day to day over the last few years. Senator Nemes.
Thank you, Mr. Chairman, and thank you all for being here, because you help a lot of the underserved and people struggling. I appreciate that. One thing I want to talk about is your short-term certificates. What are they worth? Can you give me a list of your short-term certificates? And for instance, Dr. Aaron Thompson is doing a fantastic job of letting the students know what their degree is actually worth. Because a lot of these certificates are not quite worth what they is intended unless you do a registered apprenticeship and it's stable. Some of your certificates maybe are too new for you to know that, but could you give me a list of the certificates and what they are actually worth, what people are making with them, if you get that to my office? And then companies with a registered apprenticeship program, can you kind of give me a list of who's working with you? Maybe I can help you with getting companies on that. Then in another vein, off that subject onto another, if you will allow me, Mr. Chairman. It goes a little bit with what you're talking about. The governor's early childhood, I'm sure you're all familiar with that. We were talking about, and they were trying to get forced on the daycares that they would have to hire people with certificates in childhood. I think you'd provide those.
Yes, we are one provider, yes.
And there's a problem with that. Well, the good thing about it is you have better child care. You have better teachers and better qualified people. The bad thing, and I think Senator Carroll will agree with that, it brings the cost up to the daycare, which is passed on to parents who are struggling to have child care in the first place. So that's a balancing act there. I think that that's more of a comment than a question for you all. Thank you, Mr. Chairman.
Well, there actually is no cost for them to get a CDA today. There's funding to accommodate that, and any employee or any student wanting to get into early childhood education, the funds that are there, and to go beyond that, associate's, bachelor's degree. So that's not an issue at this point. In the future, once the federal funds dry up, that may be a different story, but that's where we are today, and we use that as an incentive. We will bring someone in without a CDA, but we pay them at a higher level once they obtain that CDA, and then another higher level if they have an associate's, and another higher level with a bachelor's degree. And that's a model that works, combined with the other benefits. But
yes, but
Senator Nemes, you're right. It's the
but
funding
we have to be
part
aware
of
of
it
the
is crucial.
cost to the parent that cannot afford that.
Exactly.
Passed down.
Yes. And we just went through the process of increasing our rates at our center, and we look all throughout the region, and we try to kind of stay in the middle. But the families were okay with the rate increases because they knew that we were increasing our pay, and they knew that we were trying to get a better quality of early childhood educator within the centers. But and right now things are great. The money is there, and it will be there until 2024. I think there are quarterly payments going out between now and 2024 based on your capacity. And so, you can make these investments and you can pay better. You actually get higher level of funding the higher you pay your staff. The problem is in 2024, when this money goes away, each child care center is going to be stuck paying that level, and it's going to be difficult for them to survive at that point. And my fear is we're going to be right back where we started, and we're going to see the numbers of our providers start to tank again because the profit margin is so slim as it is. But again, a lot of issues, and I don't mean to harp on this. It's just these are conversations that I have every day. Who do we have next? Representative Jenkins.
Thank you, Mr. Chairman, and thank you for your presentation. In full disclosure, I worked at JCTC for about 10 years with at-risk students, a program called Health Career Pathways. And so I know firsthand about some of the things you're talking about. I know that there's been a trend in community colleges to hire adjunct professors and instructors not having full time. And I understand that's in response to budget issues. We're getting ready to go into a budget year. This is not the budget committee, but we're all legislators here. If we were to make an investment in the KCTCS, which I think is a good, solid investment for us, where would we get the most bang for our bucks? What should we be looking for?
Ooh, that's a good question. Certainly, I think the prevalence of adjuncts has been, in many cases, because we haven't been able to retain the full-time faculty because we're being outbid by the universities in a lot of... Yeah, I'm sorry. So one of the problems we face is that our salaries, we just can't match. Allied Health in particular, we just get outbid by the universities and private industry. So our board has taken it very seriously that we're going to be working on compensation and classification to try and get those up. Now, with flat enrollment and the need for these wraparound services, I can think of dozens of different places where we could use investments. But investments in our faculty would be very important to me. I don't know, Dr. Williams, if you want to jump in there too.
I would echo that the faculty concerns, much like the hospitals are losing nurses, we had 40 nursing faculty vacancies when we started the term. And while we've been able to fill most of those, that does impact our ability. We turn out over 900 nurses a year ready to take that NCLEX test and be out there to help meet the Commonwealth's concerns. Separately, I think we also have to look at just the larger colleges, to meet employer needs, even though we partner with employers and we do have legislative funding to support those partnerships and training. There's always a need for new equipment to keep everybody up to date and current. There's a need for simulators in our allied health programs when we can't be in the clinical sites. You saw the CDL ask. There's a huge need in the state for CDL operators. You cannot just teach that in your parking lots because you ruin your parking lots as students hit curbs and wipe out signage and, are figuring out how to drive those big trucks. So we're looking at ways to invest in CDL training centers, for example. We use CDL simulators because we can't always have students on the road. We need to give them the opportunity to also try that. We partner, as you all know, very closely with the Kentucky Department of Education on dual credit programs and have over 20,000 dual credit students that are coming through. That's a lot of training for those faculty because they also may use our online programs, so we do a lot of professional development. We're really looking at what other flexible programs can we offer. Can we offer more competency-based education versus seat-time education? Are there the apprenticeships? We'll send you that list, but right now, just direct apprenticeships, we have 65 companies and almost 500 apprentices. Those take some wraparound services and work on our side too. So honestly, we could put every dollar to work and it would be an investment in the Commonwealth because we really are working very hard to meet the needs for all of these types of employers. And we do give out a number of certificates. I don't know, Senator Nemes, if you know that CPE just released a report yesterday on the value of some of those certificates. We'll forward that to your office. But people who get a certificate, diploma, or degree, move on to a bachelor's, they do make more over their lifetime. And that means they're not only investing in their family, but they're returning to the Commonwealth through their taxes and through their buying power and everything else. So I'm just here to say every dollar
well,
does.
and I will say that we will have we have a very verbose document that we put together that we are going to make more concise about asks and what we can provide with those asks, and that will be coming out very soon once our marketing wizards can condense what we've put down on paper.
I'm smiling because our presidents are texting us about, and we could use it for this.
Thank you very much. No one paid me to ask that question. I want to be clear about that.
And I'm sorry if I took advantage.
No, that's okay. No, I wanted to hear that. And I just, for my fellow colleagues here, I'm a big fan of the community college, not because I work there, but because I've seen the good work that they do. And as our state looks to rebounding from this pandemic, we're going to need a lot more employees, trained, ready to go to work employees. And I think the community college system is the place that's going to provide those. So thank you very much for your work every day.
Just to expand on that, I know that during the special session that we just had, and I visited Baptist Health Paducah and met with their management and some medical professionals there. The one thing that they told me that they needed the most was for our schools to put out more health professionals, nurses in particular. And I know at our school, what we pay for instructors is not very competitive, and we're limited on the number of students that we can put out every year. What do you all know the numbers? And let's just stick to nurses, and this covers the lab techs, surgical techs, X-ray techs, you name it. I think we had a crisis before this pandemic ever hit in many of those fields. What are you all looking at expanding in those areas? How many nursing students do you all normally have on waiting lists? Do all of the community colleges have nursing programs? Can you just kind of in general cover that? That's such a pertinent issue today.
So on the nursing programs, all of our colleges have nursing programs. In fact, because different campuses' programs are separately managed, we have 23 nursing programs. The Kentucky Board of Nursing caps the number of seats that you can fill at any given time. And then there are also national accreditation standards that you have to meet. So the number of faculty to nurse ratios, for example, in classroom versus in a clinical site. So I believe our current cap is about 1,250 students. Last year we graduated 905 students ready to take the NCLEX. The students have to pass the NCLEX to be in practice anywhere in the country, really. But that's the same nursing test that a bachelor's degree student would take. So if a Magnet Hospital needs a bachelor's nurse, we have many partnerships with our regional and research institutions to put the extra 2 years on top of our degree. Our degree means a nurse can be at the bedside practicing, so they're there in 2 years instead of 4. That said, I give the Education and Workforce Development Cabinet a great deal of respect and kudos. We are meeting weekly on the nursing crisis. We're meeting with hospitals. We're looking at every kind of barrier. So the caps could be a barrier. If we could get more faculty and more clinical sites, which are also problematic sometimes, and could then increase those caps, then obviously that would give us greater opportunity to meet those needs. At some colleges, we have more students or applicants than we have seats. At some colleges, we do not. Some of the colleges, I don't know if it's COVID lately or what, but Madisonville, for example, reported that they took every qualified candidate that they had, and they still had some seats available. And then we do have a lot of students who are not retained for one reason or another, or step out and come back. Just as you heard about these non-academic barriers, that is an incredibly difficult program. It's very time-consuming because of the number of hours. And if you get sick, if a family member gets sick, if your child is suddenly out of school, if you get into clinical jeopardy or academic jeopardy for some reason, that sets those students back. And so that's where the wraparound services that Dr. Zarapata has mentioned so many times, success coaches, tutors, people who can be sure you're being referred to appropriate social services, make an enormous difference. I don't know if you've heard from the Kentucky Chamber on their talent pipeline management process, but they're working with several large collaboratives of employer hospitals just on the RN position, all of the providers, and how can we both increase the number of students going through the program and retain those students in the program to graduate successfully. And I feel like, I'm talking nursing once a week, if not more, and it's an enormous problem. And so again, that support of any kind makes a big difference in that effort.
Can I make a formal request today that you all start pulling the numbers together? All of that information you just gave and anything related to nursing positions and other programs that you all have, and then maybe something showing the trends. This is something that is going to be discussed between now and the next session, and I expect that there will likely be some movement in legislation to not just for community colleges, but our universities also. And this is something that we have got to address quickly. And if you all could get ahead of the game for us, please, and have that data together.
We can turn that around pretty quickly.
Good. All right. Thank you. I appreciate that. Representative Beckler is remotely. Can you hear me, sir?
Yes, I can. Thank you, Mr. Chairman. I, too, have a couple questions about the nursing program. I didn't realize when we started we were going to zero in on nurses, but did I understand correctly that the state caps the number of seats?
Yes, sir. The Kentucky Board of Nursing sets caps. Colleges, private, for-profit, public colleges have the opportunity to increase them a certain number. I believe it's 20 students, but I'd want to check that without having to go back before the board. After that, you have to take to the board a proposal to increase your number of caps and show that you have faculty, resource, clinical site, other capacity to meet the needs of those students to ensure appropriate clinical experience.
How often do those caps change? And do they change strictly because of what you all tell them, or do they come and actually visit various campuses?
It's my understanding of the process, and I have been to the Education Committee of the Kentucky Board of Nursing, that any college wanting to increase their caps goes before that Education Committee. The Education Committee then makes a recommendation to the full board. It is done at the request. Galen, for example, College of Nursing, has been up recently. A couple of our colleges have been up recently looking to increase those caps. As the Education Committee is reviewing the cap numbers, they also take into account the retention and graduation data from the program site and a number of other factors. We have a very committed leadership committee of the program directors of each of our nursing programs. And they're really working with that Education Committee and with the Board of Nursing to ensure that they understand the differences and the benefits of two-year programs of nursing, again, regardless of provider, versus the four-year nursing program. Because I think sometimes it's easy to look at a nursing program as a university program. And again, our students have much different barriers. They bring in much different academic preparation. And that's true of most two-year programs. And so we do have to provide a lot more services and may not always have exactly the retention numbers they might think are appropriate.
I'll just make a comment on that. I would hope that they are very receptive to the requests from the two-year colleges, especially at this time when I keep hearing about we have nursing shortages.
Thank you.
As well as one other question about nurses. If I understand correctly, you had just over 900 graduates last year. Can you break down, is that RNs or LPN programs?
That's registered, we call them associate degree nurses, and they do sit for the NCLEX and are registered nurses. We have other numbers of LPNs. And then we are also the registry for the state registered nurse aides who work in the long-term care facility. That's the first step, or could be the first step on a nursing pathway. We register a lot of students. Some of those are not really going into the long-term care facility. They're more preparing for nursing school, because often that's a requirement for the nursing school. But we do have graduates in each of those three areas. And our high schools and many of our long-term care facilities also prepare the coursework and the individual for the state registered nurse aide test.
Okay, I just want to verify that I understood correctly. Those 905 graduates are registered. They graduated as registered nurses, correct?
They graduated as associate degree holders if they pass the NCLEX, and we do have high pass rates, but they must pass that national exam before they're considered a registered nurse. That's the certifying body.
Fair enough. Thank you. I appreciate that. You said you have a high success rate. Do you know, is that a 90%? Is it 75? Is it 99? Can you tell me what that is?
I could not tell you by college, and I don't have the average. I'm sorry. I'm happy to get that for you. I can say that we meet the accrediting program baseline at all colleges. We don't have any college on probation for a low number, but I regret I can't give you the exact number right now.
If you could break that down for me and let me know, and you can get it to staff, and I'm sure they'll submit it to the rest of the committee members. One last question, Mr. Chairman, if you'll allow me, and it doesn't have to do with nursing. Do you know on your two-year programs how a percentage of how many folks go on and actually get a four-year degree?
Yeah. Our data person can get that for you.
I would like that as well.
Okay.
Thank you for your presentation and your responses. Thank you, Mr. Chairman.
Thank you, Representative Beckler. You said something that caught my attention. In the nursing programs, some of those who are getting the associates in nursing are required to get the CNA certification as part of that. Is that correct?
It's not that they're required, sir, but for some program admissions, then they are asked to show that they have received that. It's not every college or every university, but some of our colleges do require that in their admissions process.
I see. And sometimes I could see that taking up slots for CNAs that could be in nursing homes that are, from students that are going on into nursing school.
I don't think it takes any slots.
I don't think so.
Those programs, those state registered nurse aid programs are taught in the high school, so students out of a high school can be taking that test. I mean, the test, we'll give the test to anybody who's ready to take it. We prepare those. There are proprietary institutions that do that. Many of the independent colleges, like University of Campbellsville, do that. Several of the nursing home provides their own training. There's not a requirement that they take a credit class, only that they be ready to sit for the exam.
I see. Okay, thank you. Senator Thomas.
Thank you, Mr. Chair. Good to see you again, President Zarapata.
Yes.
Dr. McCall, good to see you as well. We passed Senate Bill 2 last week in our special session. And one of the provisions that I liked about Senate Bill 2, in fact, I mentioned this on the floor, was section 6 of that bill, which said that colleges and universities were going to be encouraged to engage in a public awareness campaign about COVID and about the benefits of the vaccine to encourage Kentuckians to obtain the vaccine. You had indicated, and you are like a lot of colleges here in the state of Kentucky that have really experienced declines in enrollment because of COVID. Mm-hmm. And I think we all know until we get COVID under control and beat it, it's going to continue to be a problem with regard to our industry and education alike. My question, and I guess I'll direct it to you first, President Zarapata. What are you going to do since we passed Senate Bill 6 to engage in a public awareness campaign to have people understand the benefits of vaccine? And I tell you, I'm coming from this because I'm very fortunate in that I have a community college in my Senate district, BCTC, right there in the middle of my Senate district, and a school I was once on the board of. Back from 2002, 2007, I was on the board of that community college. It's in a perfect location to do a public awareness campaign because it sits right there, as you know, in the middle of a community that has not been vaccinated at the level that we've seen in Lexington, which has a very high level of vaccinations. So I think that's a prime area to do public awareness in about the vaccine and the benefits. But again, my question is generally across this state, have you given any thought about what you're going to do to implement the provisions of Senate Bill 2?
We have had some initial discussions about it. There's a campaign that all the universities and KCTCS is going to participate in, coordinated by CPE, about the value of higher education. One of the legs of this has got to be something around the pandemic. Lexington's doing a pretty good job with the vaccine. We've got pockets of the state where we've got faculty and staff that don't want to get the vaccine. And so we're fighting an uphill battle there. But I have certainly, in every communication that I've put out, encouraged all of our students, faculty, and staff to get vaccinated. We can probably do more through a system-wide marketing campaign. Those dollars get tight sometimes, but your point is very well taken.
One final comment, if I may, Mr. Chair. Thank you. Dr. McCall, as you probably know, BCTC may be different. We've got a very strong nursing program there at BCTC. In fact, we probably have people on a waiting list to get in nursing at BCTC. And I want to commend Dr. Capo for his work there and having such a strong nursing program. And maybe you can speak with him and see what can be done to model that to your other colleges, because BCTC has a very, very strong nursing program.
It does. Thank you.
Thank you, Senator. Just to summarize the nursing discussion, so the Board of the Nursing would need to be involved in this conversation as far as setting those numbers. the accreditation that needs to be taken into consideration on what those requirements are. So we're looking at probably investments of additional staffing, probably increasing pay in order to recruit additional staffing. The facilities within each community college, I know they have like a mock hospital area, probably increased investments in that to expand. Are there programs that run, are most of those day programs, or are there like evening classes in nursing, and how are those normally administered at each campus?
It's different across the 23 programs. Most of them are day programs, and many of them are 10-month programs and not 12-month programs. That's for a couple of reasons. One is that the nurses have to do some time in a hospital to maintain their licensure, and so they use some of that 2 months. But separately, it is a primarily female enrolled program, although we're getting more male nurses all the time. Those female nurses do often have children. Their children are out of school in the summer, and so we do not often offer a full course load in the summer. We might offer 1 or 2 online classes or do some makeup work, that sort of thing. But also that 2 months of not paying nurses gives them time to earn 2 months of a hospital salary, which helps them offset what we're able to pay. So we do have some evening classes. We try to move as much online as possible, or flip classes where the didactic and lecture is online and then they're in a clinical site or in a lab while they're in the classroom. We do it a number of different ways. We have 4 different because of the way we came out of the technical program system, and because different institutions have changed their programs up a little bit to meet their community's needs or the availability of clinical sites at their hospitals, we do have 4 different pathways. So same degree at the end, same test at the end, but different ways that the courses are offered. And sometimes students move around based on how one of those pathways really meets their needs.
In the other programs that the community colleges offer in healthcare, X-ray tech, lab tech, are those uniform throughout the state?
They are not all of them are offered at each college. We can certainly give you a list of what is at each college. The programs are offered based on the number of job openings in the community and how they can serve that. And sometimes they're offered really because they're so limited. I mean, a dental assisting program or dental hygiene can take 12 students to 1 dentist. That's not very many students and a very highly paid faculty member. So some of them are really specialty driven, particularly by the accrediting agencies.
Very good information. Any other questions? Representative Fleming.
Thank you. I'm going to take advantage, since apparently the presidents are zooming in and so forth. I'm part, and this is a totally different track from nursing and so forth, but I'm part of an aviation caucus, and we're looking at finding some synergies through you all to help cultivate over $10 billion industry and over 600 companies that provide or feed into that area. And I've talked to a couple of universities that offer programs. I'd like to request if you can put together an inventory of any aviation-related programs that is in addition to that have some type of a tie, not the programs, but maybe in general, a tie with local high schools, and providing that'd be most helpful, because we're looking at putting forth some legislation that will help cultivate that profession in industry, and providing try, like I said, support those things. So I appreciate if you can provide any information you can.
Absolutely.
Thank you. I have one final question on my list. When you all have students that are indicating a desire to withdraw, is there a standardized process in addressing those students?
Yes. Yeah, yeah, there is. We have a process faculty use. It's been moved online. Obviously, we try to make interventions to stop that, but there's sometimes when they just have to withdraw.
And I agree with the comment that was made earlier, and I think it was Representative Jenkins that made it. You all are crucial to the success of this Commonwealth, and I think that role is going to increase with each year as we get more industry into our state, and as we require specific training for that industry. You all are going to play a huge role, even I think more so than you do now. And I've seen a willingness throughout the system to be able to adapt, like you said, Dr. Williams, to the local area, to the needs, depending on what industry is in that area. And I think that's a very successful model. And so you all have your challenges in the years to come, and we will be depending on you. And I think I speak for everyone. We're just very grateful for all the efforts that you do make and the successes that you have in each of our communities with the various programs that you have, and look forward to working with you in the years to come. And I apologize for all the homework that you all are leaving here with, but this committee likes to learn a lot of things, so we're very grateful for you all providing that information. If there are no other questions, Dr. Zarapata, Dr. Williams, thank you both for being here. Some excellent information, excellent presentation, and we look forward to hearing from you again in the future. But when you all can get some of that data together, if you could get it to leadership in the Senate or get it to me, and I know the House will also be looking in this area to see what we need to do. But as we're dealing with the immediate crisis, it would be foolish of us to not start planning ahead for 2-4 years down the road, and what we could do perhaps in the next session that would churn out more nurses 2 years from now. And I think we have to consider that, and I know that you all can't just say, poof, we're going to do that, but we need to start working through that process to make sure you all have the support that you need to make that happen, along with our colleges and universities.
Well, we appreciate the opportunity today. We are all about agility and responsiveness. We know that there's going to be a lot of eyes on us coming as we get Kentucky back to work, and I'm real easy to find through email. There's not very many Zarapatas, so please reach out.
I think you're the only one I've ever heard of.
Pretty sure. Anyway, thank you very much.
Thank you all. If there's no further business, I'll entertain a motion to adjourn. We stand adjourned.
Oh, jeez. I left my phone back there, so I wouldn't be tempted.
I told Alan to text you if I didn't know an answer.
2 days in a row.
I know. How are you? Thank you so much.
Thank you. We really appreciate it.
I enjoyed it so much. And
we so appreciate it.
And I just couldn't have picked, I thought, was a more timely topic.
Oh, you're not kidding.
It was perfect.
Given what we're facing in this country.
It was perfect. Thank you so much.
Yes.